Potassium is one of the most heavily tested electrolytes on the NCLEX, and for good reasons. Imbalances in this electrolyte can affect the heart and the muscles, sometimes within minutes. So, let's talk about the normal ranges, what causes potassium imbalances, the findings you need to recognize, and the nursing priority interventions. Before we get into the details, it helps to understand where potassium lives in the human body. Potassium is mostly found inside the cells, and it plays an important role in how the heart conducts electrical signals and how muscles contract. The normal range is narrow, which means even a small shift can lead to serious effects and symptoms. And that's why potassium is a very important electrolyte you must understand for the NCLEX. The normal range you need to know for potassium is 3.5 to 5.0 milliequivalent per liter. Anything below 3.5 is hypokalemia, and anything above 5.0 is hyperkalemia. You need to know this range because almost every potassium question on the exam will need you to identify whether a lab value is within normal range or outside of the normal range. Hypokalemia. Most of the time, hypokalemia happens because the body is losing potassium faster than it's replacing potassium. Diuretics are one of the most common causes, especially loop diuretics like furosemide. Potassium loss can also happen through the GI system from vomiting, diarrhea, and nasogastric suction. Poor dietary intake can also contribute to hypokalemia. And here is a critical point. Think about patients with DKA. Giving IV insulin as ordered to this patient will actually shift potassium from the bloodstream into the cells. This can drop the serum potassium level even without any true potassium loss from the body. Think of hypokalemia like this. It will lead to a slowing down of the body's electrical and muscular systems. The heart is especially sensitive to low potassium, so watch for cardiac dysrhythmias. On the EKG, look for flat T waves and the appearance of a U wave. This is another critical point for the NCLEX. Patient experience muscle weakness, leg cramps, and fatigue. Low potassium slows down the GI tract too, leading to decreased bowel motility and constipation. In severe cases, patient may develop a paralytic ileus. What do we do as nurses? Nursing interventions for hypokalemia include close cardiac monitoring because the heart is the organ that is mostly at risk when potassium is not balanced. Potassium replacement is needed in the treatment of hypokalemia, either by mouth for mild cases or by IV for severe cases. Here is a safety rule you must never forget. IV potassium should never be given as a bolus or IV push because it can stop the heart. It must always be diluted appropriately and administered slowly through an infusion pump. You can also encourage your patient to eat potassium-rich foods like bananas, oranges, potatoes, and spinach. This will help to maintain their potassium levels. Let's go over some practice questions. This is question 1. A client receiving furosemide is reporting muscle cramps and fatigue. Which lab result is most concerning? Answer choice A, potassium of 2.8 milliequivalent per liter. B, sodium of 138 milliequivalent per liter. C, calcium of 9.2 milligram per dl. D, magnesium of 2.0 milligram per dl. What do you think about this question? Which one will you select? Correct answer is A, potassium of 2.8 milliequivalent per liter. This is the rationale. Furosemide is a loop diuretic. It causes potassium loss. A potassium level of 2.8 is an indication for significant hypokalemia. Remember, hypokalemia is a risk factor for cardiac dysrhythmias. The other answer choices are not correct because the levels are within normal limits. This is question 2. Which EKG finding is most consistent with hypokalemia? Answer choice A, peaked T waves. B, widened QRS complex. C, prominent U waves. D. Sine wave complex. What do you think about this question? Which answer choice will you select? Correct answer is C. Prominent U waves, because hypokalemia causes cardiac dysrhythmias like flat T waves, prominent U waves, and a high risk for ventricular dysrhythmias. The other answer choices are not correct. This is question 3. This one is yours. A 45-year-old patient was admitted with persistent vomiting. Here are the lab values. pH is 7.50. CO2 is 47. Bicarbonate is 30. Potassium is 3.0. NGN step 3 is prioritize hypothesis. This is the question. What is the priority health problem for this patient? Answer choice A, hypokalemia. B, alkalosis. C, dehydration. D, nausea. What do you think about this question? Place your answer choice in the comment section. Thanks for watching and learning from this video. Like and subscribe to this channel for more rapid reviews for the NCLEX. Don't forget to place your answer and any questions you may have in the comment section. See you next time.